Ugh, if you've ever had your back go out, you know exactly what I'm talking about. That sudden, awful pain, it makes you desperate for relief. And you just have one question, right? What really works? Well, in this explainer, we are going to dig into the actual science and get some clear answers. Okay, first, let's just get a sense of how big this is. Low back pain. It's not just some minor inconvenience. According to a huge study, the Global Burden of Disease study, it is the number one, the single biggest cause of years lived with disability in the whole world. Just let that sink in. Of all the things that can go wrong, this is at the top of the list. And that giant global problem? Suddenly, it's your problem. It's landed right in your lap. You're in pain, and you just want something, anything that will help. So, what do? What do you reach for? What does the science actually say is the right move?
All right, so to find those answers, let's start with the problem itself. It's what some experts are calling the world's biggest pain. And trust me, if you're dealing with this, you are so not alone.
You know the scene, right? You're in the pharmacy, just staring at this wall of boxes, and every single one is promising sweet, sweet relief. Which one do you pick? This one? That one? Maybe you need something from your doctor? It's totally overwhelming. And look, making the wrong choice isn't just a waste of time and money, it could actually make things worse. So how do we cut through all that confusion? Well, we're going to go straight to the source. We're going to look at the official rule books that doctors themselves use to make these kinds of decisions. Yep, it's time to decode the guidelines. And hey, lucky for us, some researchers already did the heavy lifting. In a big 2022 review, they took 9 of the world's top, most respected clinical guidelines for low back pain, and they basically put them all in a room together to see where all the experts agree, and maybe more importantly, where they don't. And these things, these clinical practice guidelines or CPGs, they're a huge deal. This isn't just one doctor's hot take, you know? These are documents built on, well, on mountains of scientific evidence. They're designed to give the absolute best advice possible. I mean, this is basically the foundation of modern medicine. So what did they find when they put all these guidelines together? To make it super simple, we're going to use a traffic light system. Let's start with the green light. These are the green light drugs, the ones that get a clear yes from pretty much everyone. And the big winner is NSAIDs. That stands for non-steroidal anti-inflammatory drugs. You probably know them as ibuprofen or naproxen. Yeah, this category of drugs was by a long shot the most recommended one. And just look at this. It really shows you how strong the agreement is. Out of 9 total guidelines they looked at, a whopping 8 of them recommended NSAIDs for back pain, whether it was new or had been around for a while. Seriously, in the world of medicine, that's about as close to a slam dunk as you're ever going to get. So, okay, NSAIDs are the topic. They're what's called a first-line therapy. But, and you really have to hear this part, the guidelines were also completely united on how to use them. Take the lowest dose that works for the shortest amount of time possible. Period. Because they do come with real risks, especially for your stomach and your heart. All right, so we've got our green light. Now let's go to the complete opposite end of the spectrum, the red light drugs. These are the ones that get a hard no, the ones that experts around the world agree you should just avoid for most low back pain. And this is pretty shocking, actually. It wasn't like 1 or 2 guidelines said be careful. For several types of drugs, not a single one, not one of the 9 expert panels recommended using them. And this slide just lays it all out. When it comes to typical low back pain, the expert advice is a solid no on a bunch of common drugs. We're talking benzodiazepines, things like Valium, oral steroids, anticonvulsants, and yeah, even antibiotics. The message here could not be clearer. Steer clear. And there are really good reasons for this. The review points out some serious warnings right from the guidelines themselves. Take benzodiazepines, for example. The risk for really bad stuff like abuse, overdose, even death, it just completely outweighs any tiny benefit they might have for back pain. Okay, now for what I think is the most fascinating part. The yellow light drugs. The It's Complicated crew. This is where the evidence gets all murky, the experts can't agree, and a lot of what we think we know gets put to the test. Let's kick things off with a huge one. Acetaminophen. You know it as Tylenol or paracetamol. For decades, it's been the first thing people grab. But this is where common belief just smacks right into the scientific evidence. The review found that a bunch of guidelines point to top-quality studies showing that for a new case of back pain, acetaminophen is literally no better than a sugar pill, a placebo. Yeah, for a lot of people, that is a mind-blowing finding. Okay, next up in the yellow zone, skeletal muscle relaxants.
Doctors prescribe these all the time for those awful back spasms. But are they actually a good idea? Well, it turns out the answer really depends on who you talk to. So get this, out of the 7 guidelines that even looked at muscle relaxants for new back pain, the majority, 5 of them, actually did recommend them, usually as a sort of plan B, a second choice option. But the other 2, they recommended against using them at all, for any kind of back pain. They pointed to side effects like drowsiness and the risk of abuse. And that right there, that 5-2 split, that is the perfect definition of a yellow light.
And of course, we got to talk about opioids. Now, they're not a hard red light like those other drugs we saw, but they are deep in the yellow zone with a big flashing neon warning sign attached. The consensus is pretty clear. They should only even be considered for really severe short-term pain, and only if all the safer options have already failed.
Okay, so after all that, what's the big takeaway for you? Let's boil this all down to what you actually need to remember the next time your back starts acting up.
Here's the bottom line. Green light? Think NSAIDs, but be careful with them. Red light? Just stay away from those drugs that all the experts agreed are a bad idea. And for that yellow light category, be skeptical, really. Just understand that for a lot of common stuff like acetaminophen and muscle relaxants, the evidence is weak or all over the place, and a lot of the time, the risk of harm is actually bigger than the potential for help.
And that leaves us with one last really important question. You've got the world's top experts, they've looked at all the evidence, and what did they recommend? A less is more approach. So maybe the biggest takeaway here isn't just which pill to take, but whether our first instinct to reach for any pill is the right one to begin with. Maybe it's time we all start to rethink how we respond to pain.